Pharmaceutical companies often contract out their clinical research. Ventavia was hired to run Pfizer COVID-19 vaccine trials. Due to the heavy workload, Ventavia needed more help and brought on Brooke Jackson, an experienced clinical trial auditor, to oversee and manage quality control at 2 Pfizer trial sites in the Dallas area. Jackson told me that from day one, she found major problems, which she attributed to the unusual speed of operations.
They were getting pushed directly by Pfizer to enroll more patients. I was having to bring so much to their attention. I've never been a part of a clinical trial in all of my almost 20 years of experience run like this ever.
Jackson says the issues she saw compromised the integrity of the data and patient safety.
The first thing that I would look at is the informed consent form. When I'm looking at one signature page and comparing it to the signature on the next page, the signatures are not matching. Where the principal investigator is supposed to sign off, his signature's missing. The physical exam wasn't done. Something that, as an auditor, I'm trained to look for is repeated data. So you can tell by the laboratory processing log that this person is inexperienced in research. When I look here at this 30 minutes, every patient's blood clotted for 30 minutes. Per Pfizer's protocol, it could be anywhere between 30 to 90 minutes. So this data is falsified. This data is fraud. We were not monitoring the temperature of the vaccine. The temperature needed to be at least -70 degrees. I immediately went to my managers and said, this is a serious problem. If we were to be investigated or inspected by the FDA, we would be shut down. The next most concerning of my findings was that everybody that was enrolled in the trial from July through the middle of September of 2020 had been unblinded to their treatment assignment. The site staff knew if the patient received placebo or whether they received the actual vaccine. It was a direct violation of Pfizer's protocol. It should have halted the enrollment of any additional participants, and we should have contacted Pfizer. What Ventavia wanted to do instead was lie to Pfizer, go into everybody's chart, and remove that randomization assignment and destroy the evidence. This is a quote from Christy Rainey, who's one of the owners of the company. She wanted to make the pause in enrollment like it's no big deal. I wouldn't say one negative thing. I would keep it that we were in the perfect place and we were being responsible. The person that was in charge of vaccinating our patients was working, again, way beyond her scope, had no medical training at all, and the position that she held right before coming to Ventavia was at a restaurant. And this was a person, again, that was responsible for preparing the vaccine and the one that was responsible for injecting it. One of my top findings was the lack of reporting of adverse events, and that included some that were serious.